will now go to the public health domains. The public health domains include promotion of health, prevention, treatment, and rehabilitation. Health promotion is a guiding concept involving activities intended to enhance individual community health as well as to seek or increase involvement and control of the individual and the community in their own health. It acts to improve health and social welfare and to reduce specific determinants of diseases as well as risk factors that adversely affect the health, the well-being and the productive capacities of an individual or society, setting targets based on the size of the problem, but also on the feasibility of successful interventions, that is, a cost-effectiveness way. Health promotion is a key element in public health and is applicable in the community, clinics or hospitals, and in all other services settings. It raises awareness and informs people about health and lifestyle factors that might put them at risk. Prevention. Prevention refers to the goals of medicine that are to promote, to preserve, and to restore health when it is impaired, and to minimize sufferings and distress. And there are 3 levels of prevention: the primary, secondary, and tertiary prevention. With regards to primary prevention, it includes activities that are undertaken to prevent the disease and injury from occurring. It works with both the individual and the community. It may be directed at the host to increase resistance to agents such as immunization and cessation of smoking, or may be directed at environmental activities to reduce conditions favorable to the vector for a biological agent such as mosquito vectors of malaria. Activities and approaches to prevent disease of injury include health education, health screening, immunization, vector control, and etc. While secondary prevention is the early diagnosis and management to prevent complications from a disease. It includes steps to isolate cases and treatment to prevent further epidemic outbreaks. Tertiary prevention involves activities directed at the host, but also at the environment in order to promote rehabilitation, restoration, and maintenance of maximum function after the disease and its complication have stabilized. And these examples include providing a wheelchair, special toilet facilities, doors, ramps, and transportation services for paraplegics, which are often most vital factors for rehabilitation. Public health program focuses on promotion of health, prevention, curative care, and rehabilitation. The programs among which are the disease control, family health development, food quality control, health education and promotion, occupational and environmental health. And there are various activities under each program. For example, under the family health development program, there are MCH or maternal and child health, school health, adolescent health, and etc. While for disease control, it can include communicable and non-communicable diseases, vector-borne diseases, and many others. The major disciplines in public health. There are various disciplines which are important. First is the nutrition. Nutrition is the science of food, whereby the nutrients and other substances therein, their action, interaction, and balance in relation to health and disease. Second is reproductive health. This is a state of complete physical, mental, and social well-being, not only absence of disease or infirmity, in all matters relating to reproductive system and to its function and process. The third discipline is environmental health. The basic approach to environmental control is first to identify specific biologic, chemical, social, and physical factors that represent hazards to health or well-being and to modify the people from harmful exposures. The principal components of environmental health are water, sanitation, waste disposal, etc. Fourth is on health education. This is defined as a combination of learning experiences designed to facilitate voluntary actions conducive to health. It is an essential part of health promotion. Fifth is epidemiology. This is the most common known disciplines of public health. The study of frequency, distribution, and determinants of diseases and other related states or events in specific populations. This is where the application of the study to promote of health and to prevent as well as to control health problems is evident. Sixth is health economics. It concerns with the alternative use of resources in the health service sector and with the efficient utilization of economic resources such as manpower, material, and financial resources. The other common major disciplines associated with public health is biostatistics. Biostatistics is the application of statistics to biological and medical problems because of uncertainties of actual number in the real world. It's about estimating the magnitude of problems from a sample and representativeness as well as generalization of results to a bigger population. Next is health service management. This is on getting people to work in a systematic way, harmoniously together, and to make efficient use of resources in order to achieve objective. The ecology, on the other hand, is the study of relationship among living organisms and their environment. It is the science which deals with the interrelationships between the various organisms living in an area and their relationship with the physical environment, or ecology. Human ecology means the study of human groups as influenced by environmental factors, including social and behavioral factors. Demography, on the other hand, is the study of population, especially with reference to the size and density, fertility, mortality, growth, age distribution, migration, and the interaction of all those with social and economic conditions. Research is, on the other hand, a conscious action to acquire deeper knowledge on new facts about scientific or technical subjects. It is a systematic investigation towards increasing knowledge, recovery and interpretation of facts, revision of accepted theories or laws in the light of new facts of practical application of such new theories of laws, aimed at translating evidence to health policy. There are many new disciplines of public health that are coming out. Let us now differentiate between community health and public health. Community health refers to the health status of a defined group of people and the actions and conditions, both private and public, to promote, protect and preserve their health. Public health, on the other hand, refers to the health status of a defined group of people and the governmental actions and conditions to promote, protect and preserve their health. This is the domain of the government. Now let us differentiate between clinical medicine and public health. Clinical medicine is concerned with diagnosing and treating diseases in individual patients. It has evolved from a primarily medical and nursing service to involve a highly complex teams of professionals, while public health involves both direct and indirect approaches. Direct measures in public health include immunization of children, modern birth control, hypertension, and diabetes case findings. Indirect methods used in public health protect the individual by communities, such as raising standards of environmental safety, assurance of safe water supply, sewage disposal, and improved nutrition. Let us now look at the process of clinical care. The process of clinical care involves patient, practitioner, or the doctor, whereby chief complaint will be taken up for history taking, as well as physical examination will be conducted, followed by laboratory tests, and these are all for clinical diagnosis. Then they will be given treatment, home monitoring and follow-up testing, as well as follow-up visit. On the other hand, the process of community care involves a defined population in relation to the health system, community perceived needs, professional opinions of community need, epidemiologic analysis, community diagnosis, interventions should be given, monitoring efforts, and modification of all the above steps. I hope you have understood what has been taught thus far, pertaining to health determinants, pertaining to what is public health, as well as the domains and disciplines of public health.